surgeon in the Vietnam War, Dr. Sam Scheinberg recognized a need for an item he later developed and has seen put into use worldwide. While touring with a gum wrapper, he noticed something we all have. It's relatively rigid when bent in a certain way. But in the context of his life in combat, the observation was more than casual. It led to the development of an industry-acclaimed medical tool, the SAM splint, a simple yet versatile method for immobilizing almost any part of the body. Now, it's constructed of a thin sheet of aluminum, covered on all surfaces, even the edges, with medical-grade hypoallergenic foam. Of course, rapid worldwide acceptance of such a revolutionary idea has not been without its problems. Not with the product, but in teaching people its correct use. The SAM splint comes out of the package looking like a limp noodle, so it's difficult for people to understand how something so flexible can function as a splint. In this video, we'll demonstrate the correct use of the SAM splint in all situations and show you why you should be keeping a few of these babies on hand. Correct use of the SAM splint is essential. You need to see what we're about to show you. Several decades and half a world away from the war in Vietnam, life in the Pacific Northwestern United States showcases the need that still exists for Dr. Sam Scheinberg's brainchild. People out here are still pioneers of a sort. They work hard and play hard in a rugged, often dangerous environment. What better place for the SAM splint to call home than the spectacular Oregon coast? Newport, in fact, new home of Free Willy star Keiko the whale. Keiko's trademark is his drooping dorsal fin. We'll talk more about that later. This is Dr. Sam Scheinberg. With his expertise and my body, and those of a few family and friends, we'll get right to our demonstrations. What's up first, Doc?
Thank you, David. First of all, I'd like to mention there's some fundamentals, some basic principles. And the first basic principle that people need to know is this is a radiolucent splint. That is, X-rays pass through it. You do not need to remove the splint to obtain X-rays. The next thing to know is that it is washable and reusable. You can wash it with soap and water, or if you get body fluids on the splint, you can wash it with 1 part Clorox and 10 parts water, or whatever protocol cleaning solution that you normally use. Also, it's important to know that the splint is very easily cut. It's cut just like paper, and that exposes a very tiny metal edge. And to get rid of that edge, all you have to do is fold the splint over on itself in this manner, and the edge disappears. Some people prefer to tape the edge. The next thing to know is that when you make the bends in the splint, you should make as many bends before applying it to a patient. Only the fine adjustments should be made on the patient. Remember, the patient has an injured, perhaps a broken limb, and they're in pain, so you don't want to bend the splint on the patient very much if they're in pain. And the last thing to remember is that the splint does not need padding. It has padding in place, and if you're going to transport a patient or leave the patient in the splint for several hours, you don't need to apply padding. But if you're going to leave the splint on for several days or weeks, then you need to apply some type of soft absorbent, perhaps a cloth padding, just as you would beneath a fiberglass cast or a plaster cast.
Doc, this thing really does seem flimsy as a noodle. Can you show me how you make this rigid enough to splint someone?
Well, you're absolutely right. It is flimsy as a noodle, and it has no strength at all until you put in what I refer to as the basic bend. And that is just a simple curve. Once you curve this splint, it becomes rigid.
Ah, the gum wrapper.
That's right. All of the strength is gained from the curve. So we've curved this side. Now, if you push down on that side, go ahead, push down. It's solid as a rock, but push on this side. See, it has no strength. And if we were to put a bend in this side, as we did in the other, now push down. It's hard. So that's how we create a splint from something that is totally soft. But the neat thing is, if we remove the bend, it's now soft, just like it was before.
You can carry it anywhere.
Carry it anywhere, fold it up, put it in your fanny pack or in any kit. And so it's very handy. You can make it hard or you can make it soft, depending on what you want to do.
Well, Doc, I'm in relatively good health, but why don't you show me how to use that thing?
Well, why don't we start with your fingertip and just work our way up.
All right.
Let's suppose that you had a broken finger, or what's very common is just a cut or a break to the end of the finger. What you do is you take the SAM splint, just a small one here, and you curve it to create that basic bend to make it into a rigid splint. then you simply place the finger in the splint, and of course you could, if you wanted, fold up the end to create a finger guard. You can hold it in place with tape or any kind of a wrap that you want.
But I couldn't play the piano with that.
No, you couldn't. Now, another injury on the hand, which is common, is a ski pole injury, where you injure the ulnar collateral ligament to the thumb. And in this case, you can place the splint just to the side of the thumb like this to protect that ligament, and again, apply tape or a wrap at the end and also around the proximal end of the splint to hold it in place. You know, in addition to splinting the fingers and the thumb, these splints are wonderful for neonatal IV boards. They're, you know, the little newborns are very small, and there are not many things that will actually fit them and work as IV boards. And because the splint is so flexible and soft, you can imagine you can take the little baby's little arm and put it in here, and it works very well for that purpose. Now, if I may tuck this in here.
Okay.
Can I use you as a model? Would that be all right?
You certainly have my permission.
Thank you. Now let's suppose that you broke a wrist. Again, we always want to use the basic bend, which is the curve. And there are different ways to do it. One way to do it is just to create a double bend in the splint, and that is I bend it not exactly evenly so I can overlap one edge, and then to make it still very soft, to create a splint, I then put a little curve in it like this, the same curve, and now it's hard. And if I can splint you just in this manner for a Colles fracture or any type of a wrist or metacarpal injury, or even for a forearm. And if you have a deformity, I can shape and bend the splint to fit the deformity. You won't be able to do this very well because your arm isn't broken, but when you have a break, it's easier to bend in odd directions.
There's only so far I'll go for this.
Yeah, I don't blame you. Now, the next thing we can do is create what we refer to as a sugar tong splint. And that is, it looks very much like the little tong that you lift sugar cubes. I know you were raised in a very refined atmosphere, as was I. And so what we do is create the basic bend in the splint just in this manner, and create a little tong, that is a little curve on each end. And now if I could borrow maybe this arm, and we set it in just like that. And of course we'd wrap it up, and that's good again for the wrist or for the forearm. But this is in a situation maybe where you want to allow the person to use their elbow, but you still want to prevent rotation, and you want to splint the bones, both bones of the forearm and the wrist. Now the next thing that happens is people have dislocated elbows, and they almost always dislocate with the arm stuck in extension. And ordinarily it's difficult to find something that will splint a dislocated elbow. But with the SAM splint, it's not a problem. All you do is just extend the bend. And wherever the bend is, the splint is rigid. So I'm just going to estimate and put a little curve in it to get it proper length. Let's say you dislocated your elbow. Then we just stick this on like this. It's still a little bit long, but now you're splinted in full extension. And that's just perfect for a dislocated elbow.
This is rigid. This is remarkably.
Now, the next common injury is a broken upper arm. We call it the humerus, but it isn't a laughing matter. It's one of the most painful, difficult fractures that anybody has to deal with. And there's tremendous swelling associated with that. And so what we do is, again, now I'm removing the bends to make it soft, is we just fold the splint over, I would estimate about 8 inches, to create a little cup for the elbow. Now you see we have a little elbow cup. That's just to hold the elbow in place. And then you see what I'm doing is creating a little bend here on this part. That's to support the humerus. So what I do is put the elbow in, put it up like this. I can fold it on itself or back on itself, and then wrap it up, put you in a sling, and then a swath around your chest, an ace, you might want to use an ace wrap or whatever. And now you have an excellent splint for a fractured humerus, because this bone bleeds a lot. There's a tremendous amount of swelling, and with this splint in place, it supports above and below the fracture and still allows the arm to swell and move away from the body. So it's much more comfortable than, in fact, I've splinted many a humerus this way, sometimes bilateral humeral fractures, and it works very well. David, the really good thing about this splint is that it's very flexible, and we can easily fit it to the injured extremity, no matter what shape it is, instead of having to force the injured extremity to fit the splint. So David, we have some specialty uses for the upper extremity, and one is for a dislocated shoulder. What I've done here is fold the splint into threes, and what I'm going to do is create something that looks very much like a highway marker. Again, I just fold the splint, putting in the basic bend on each leg of this triangle, except I make it a little bit deeper. I make the bends quite deep. As you can see, then I hook this like this and create the bends here. So what I've done is create a triangle, a very strong triangle. Now with a dislocated shoulder, for the doctors who are watching this video, they know that typically the dislocation is in the front. We call it anterior, and the arm is up away from the body. We call it abducted, and it's rotated externally. And people are walking around with their arms up like that. It's very uncomfortable for the patient. If they happen to have a pillow, they can tuck the pillow under the arm and support the arm, but oftentimes that's not the case. And so if they don't, then they can take the SAM splint and rest their arm on it like this, and you can tape it to the body, tell the individual to hold it in place, and they just use it as a pillow or something to keep the arm supported till they have help or someone who can reduce this dislocated shoulder.
So you should keep one of those in your car not only for medical emergencies, but as highway markers as well.
It's an excellent highway marker. Another specialty use would be for a carpal tunnel splint or a night splint. That's where you want a small splint for the wrist. And you usually don't wear these at work because they get in the way, but oftentimes you can wear them at night, and they help relieve the problems associated with a carpal tunnel or with certain types of arthritis. And what I've done here is just take a SAM splint, and because this is the kind of thing someone would wear for hours, that is, they'd wear it maybe for 3 or 4 weeks, I cover it, as I mentioned earlier, with a double layer of stockinette, and just tuck it in on itself, and then I would just mold it very precisely to fit you as an individual, and hold it in place with some type of a simple wrap. The nice thing is that when they get soiled, because people perspire and they get dirt off their skin onto their splint, all you have to do is remove...
Change your sock.
That's it, change the sock. In fact, you can use the sock. You don't have to use anything as fancy as a double layer of stockinette. So that's a very handy thing. Another specialty splint is for, we call it a thumb spica splint, and by that I mean sometimes people injure their wrist and you want to immobilize the thumb. So what you do is cut off a section of splint. We'll just let that fall there. Probably what I would do, again, the basic principle is not to hurt the patient. This is a little longer than it needs to be. And I would kind of shape it around my thumb and to get the general gist of what I wanted to do. And then I would slip this around your thumb. This is still a little bit too long, so I'd fold it on itself like this. And now all I have to do is take my little wrap to hold this in place up in the upper arm, or forearm as the case may be, something like that, and tear it. And then I would secure this part around your thumb in this manner. And now we have what we refer to as a thumb spica splint.
He's so gentle.
Thank you.
Oh. Doc, is there any way to make this splint any stronger than it is?
Well, of course, it's probably as strong as it needs to be, but if you want to make a splint stronger, there's several ways to do it. One little way to do it is just to reverse the bend, put a little reverse bend on the edges, just the last few millimeters of the edge. If you reverse the bend, it increases the strength by about a factor of 4. I mean, it becomes extremely rigid and strong. Just that little bit of reverse bend on the edge. And another thing you can do if you want to is to create a T-bend, where you create a T shape in the splint. And what you've done is create kind of a piece of an I-beam there. and then it becomes absolutely rigid.
Well, is there a way to use that T-bend when you're splinting parts of the upper body to make it more rigid?
Well, there really is. I can just, if you want, I can give you an example. What you would do is create the T-bend on one limb of the splint, so to speak, and all I'm doing is creating a T-bend here, which is just what I did earlier. And now that's a tremendously strong support. And what you can then do is just take the splint and fold it over the T-bend. Again, if you wanted to, you could create some, put some tape in there. So what you have is the I-beam or T-bend supporting the extremity. And what I do whenever I do demonstrations is I offer someone a free meal at the best restaurant in town if they can break this bend. And so far I've had only one gentleman break it, and he had quite an appetite too. It turned out he was a professional weightlifter, and he was stronger than he should have been. But for most people, that can't happen.
Well, now, we've seen what you can do with the upper extremities. Can you tell me about how you would use the SAM splint on legs, for instance?
Well, I'll be delighted to, and I think we have a volunteer.
We have a volunteer.
Actually, two
legs. A lovely
legs.
pair of legs here to work on.
Yes, we do. First of all, it's interesting to know that SAM splint can be used for foot discomfort, metatarsalgia, and sore feet. And we're talking about on a short-term basis. For people who are on their feet a lot, you can slip these little baby SAMs into the shoes and position them either behind the metatarsal heads or in the arch or under the heel, depending. And they kind of seek their spot within the shoes, and it relieves pressure, and people feel pretty good. Of course, we always say if you have continued discomfort, these aren't appropriate. You probably should consult your doctor or podiatrist, but that's one little use for the splint. Now, for an injured ankle, tibia or something like that, then we use the same principle. First thing we would do is just make a little curve, our basic bend, just like that. It's a very simple little curve. And you might want to put some padding around these little bumps here. We call them the malleoli because they are prominent, and in a cast or anything you would always pad them, and I would pad them in anybody. And then you simply slip the splint around like that and then secure it with a wrap. And I have a wrap here just to give you an example. If you could just put your hold onto this for me. And come around like that. And I'll just make one turn because we don't really need to do more than that to give an example. And now what's nice is you can put inside of the splint, you can put in cold packs. You can take ace wraps and soak them in ice buckets and little slush buckets and wrap the wraps around the ankle. This maintains the cold. So it's very good. You have an immobilization and some compression and cold on an injured ankle.
And space to work with inside.
That's right. And of course you can always relieve the pressure by gentle bending or apply pressure as you need to. So that's for, say, an injured ankle. Now, if you have an injured tibia, then what you would do is just extend the splint and we create our same basic bend. But because of the length of Chris's leg, what we do is, at least I like to do, is make the splint even stronger by putting a little tiny reverse bend on the edge. Here I'll take it out, and now you can see me putting that little reverse bend on the edge, and it makes the splint much stronger. And because of her size, we'll use two splints. Again, I probably would put a little padding or something around the malleoli, and then I'm going to slip this on. Let's assume she has a broken tibia. I'm going to slip this on like this, and then if you can just kind of hold that in place and gently lift up the leg. It goes as a unit, and we secure it there, and I would then come up here and have you lift that up. If her leg was broken, we'd have, probably have someone else help to the degree that we could, and bring this around like this to secure that. And for the I probably would put maybe one more little turn around here just to secure it. It's just whatever.
Now, Sam, will this immobilize her knee? now that this is secured?
Actually, of course, you see it's above and below the knee. And if I wanted to mobilize the knee, in other words, if the knee were my prime area of concern, perhaps she had a ski injury and I was concerned about an anterior cruciate, an ACL injury, then I probably would extend this thing up further and take it. You see, we have lots of room. We have another 6 inches we can bring this up so it runs all the way from here to here and the knee is totally immobilized. And of course, you can see you can x-ray directly through it. If she says, oh, there's a little pressure there, we can easily bend it away. If there was a wound, we could open it to check the wound. Just a very safe thing. Well, David, what we've done is just take the SAM splint and fold it a little bit on itself so that it's going to be the proper size for Chris. In my case, you wouldn't need to fold it at all, but she's slim, and so what we do is just make it a little smaller, and we leave the stockinette, this tubular stockinette, loose on each side. And then if she had a pelvic fracture, we'd want to treat her by putting a little compression on it, so we'd slip this under her, and I'd work it down so that it was around her pelvis, and then the next thing I would do is just tie it. And you see, the tighter you tie it, the more compression you get on the pelvis, and it's going to make it just a little bit more comfortable, because she might have some type of separation in the front of the pelvis. It gives a little bit of support. Likewise, if she had a lumbosacral problem, then you can take the splint in exactly the same manner, and you just fold it till it's small enough, and then you pull it in and tie it, and you have a lumbosacral corset.
That's it for any lower back injury.
That's correct. And if she had rib injuries, then you can make it into a very nice rib belt. Exactly the same manner. Again, you just fold it so that it fits. You always want it a little smaller so that you have to pull it and create some compression, I should say, around the ribs and around the back and around the pelvis.
Well, Doc, I'm not the tallest guy around, and I'm not the shortest either, but does size make any difference in the use of the SAM splint?
Actually, it doesn't. When I designed this splint, I designed it so you could apply it to kids as well as large adults. In fact, we have some examples over here.
Oh, there's a large adult.
Some volunteers. That's Bobby and Corey. And I think the best way to demonstrate this is to take our splint, and what I did was just take the splint and create the little basic bends, the little curve that makes it rigid, and I'll just slip this around and onto, let's imagine that Corey had a broken tibia, and Bruce is giving me a little support there, and we simply immobilize it in this fashion, and I think you can see that it works just super. And I might want to put maybe one more little wrap around it like that. Corey, what this does is splint your leg all the way from your ankle right up to the end of this big long bone called the femur. And we hold this splint in place with whatever is inexpensive. And you can x-ray right through it, and only when the doctor is ready to treat you will he remove this, so you'll be very comfortable. Does that feel comfortable? Good. Now let's imagine that Bobby here has a broken arm, and you know how frustrating it is, doctors know that, to find something that will splint a small child. So all you have to do is to cut off a section of splint and fold it on itself so there's no possibility of having any kind of problem, and then we simply curve it, and if she has a little fractured wrist, you see we have that splint. Curves fit her just perfectly, and again all we would do is take the wrap, or whatever wrap you prefer, and put it on like that, and tape is good, roller gauze is good, and now we have a splint for her arm. So I think you can see that you can splint kids all shapes and sizes.
Well, Sam, I'm convinced it fits small kids, but what about kids of the larger variety?
Well, seeing is believing. I believe Bruce is 6'6", so why don't we have Bruce come over and we'll apply a splint to Bruce.
All right, this I've got to see. Sit yourself down there, Bruce.
Let's just bring your leg up here, Bruce, and we just continue with the basic bends, and because of the size of his legs, we're going to put the reverse bends on the edges and apply them. Just if you could support that a little bit. And again, I've just got a little wrap here to hold it in place. And it's a wrap that adheres to itself. And we just simply put that on, and you can see that we're going to be splinting his upper leg and lower leg too. We would refer to that as a thigh rather than a leg. And again, coming around here, now you could see, I think, that not only would this be very satisfactory for splinting a leg, but also for splinting an injured knee, broken tibia, or whatever. And I probably would make a few more turns around there, but for the purpose of demonstration, and what I've done here is use 2 splints instead of just 1 splint, because we're dealing with somebody who is, you know, 6'6", but the principle is the same. If I want to make any kind of adjustments, fine adjustments, I will make on him.
Well, Sam, you've shown me how to use the SAM splint on practically every other part of the body. Can you or should you use this on a neck injury?
Well, of course, what you should do is whatever your protocol recommends. But the nice thing is that a SAM splint will work on the neck, and certainly if you don't have your full selection of splints and you need to have a cervical collar, then it's nice to at least know that you can have something that you can use for a cervical collar. And probably the thing to do is to demonstrate the use of it. The nice thing to know is that this particular collar is very adjustable, and it will fit almost anyone from kids to large adults. Probably the thing to do is to demonstrate that. Sherry, why don't you come over here and I'll demonstrate on your neck. What we do is we create a simple set of bends. We put the palm here next to the end of the splint and extend the thumb and just make a bend. Therefore, I call it the rule of thumb. And then the next thing I do is put a flare in the upper end of it so it begins to actually look like a C-collar on the end. And I set this right under the neck. If she was lying down, I'd slip it under the back of her head with traction being applied to her head. And now the things we have to be concerned with is the distance between the chin and the chest, which is different from everyone, and also the circumference of the neck. Those are the 2 measurements. So what I do is bring the collar around very loosely till it hits the chest, and then I simply push it in with my thumb. Now I know I've got the proper chin-chest distance. The next thing I do is just squeeze it to create these little lateral wings, to create some lateral stability, and also to compensate for the circumference. And I can fold this on itself and get it out of the way, put a piece of tape around it, and we have a quick C-collar. Thank you, Sherry. Now I'll demonstrate the exact same thing on someone who has a totally different size neck. And Bruce again has a different size neck. Once again, we need to compensate from the distance of the chin to the chest, and we need to compensate for the circumference or diameter of the neck. Use the rule of thumb, extend the thumb wherever my thumb goes. It's generally about 5 inches or so. I flare the upper part of it so it starts to look like a C-collar, and then slip it under Bruce's neck. Now he has a lot of distance here, so what we do is bring it obliquely till it hits his chest. You see the oblique? It's more oblique in Bruce's case because his neck is longer, and what I'm doing is I'm going to simply fold it so that we have this correct chin-chest distance, just in this manner. Absolutely correct for him, but not correct for anyone else. And then fold it up, and of course, to take care of the circumference, I would put these little wings here on the sides to get the right circumference, and of course a piece of tape around the neck to hold it in place. Thank you.
Well, Dr. Scheinberg, thank you for showing us how to use your SAM splint.
You're welcome.
With a little bit of practice, even I can do this. As we've seen in practice, the SAM splint is rigid yet flexible.
Yes, it is. Flexible enough to be used just about anywhere.
Hey, I said it was flexible. Now, Keiko's dorsal fin is naturally droopy, but if it needed to be splinted, believe me, Dr. Sam could do it. And show you why you should be keeping a few of these babies on hand. Johnny Bench, I'm not. And then the higher ups, you can have a Wonder Bra. Thank you. This little piggy went to market. Eat your heart out, Tiger. My putter's bent. Hey, Sam, and show you why you should be keeping a few of these babies on hand. Any lower than that, I'll show you why you should be keeping a few of these babies.
And there you go. You have a nice form-fitting sea collar.
Sam, hang on just... once again, I'm David Anslow, and thanks for watching. You never know when the Sam splint might come in handy for you. Sam, you want to hang... Sam, just a minute. Sam, come on, I got to drive home. Sam!